there's 124 million people walking into an urgent care today in the US alone every year with respiratory infection. So that's a huge market, right? How often do you walk out of there with a result in your hand? We said, how can we build something that would maximize patient experience in an urgent care, right? And what are the requirements for that? And we will not compromise on these requirements, right? Well, number one, the requirement is you want to have a result, right? So today, 20% of the time, give or take, depending on flu season or not, you'll walk out of there with a result. So you're going to come out, you're going to wait, you're going to be $200 out of pocket. If you're insured, it's going to go right into your deductible. It's not working, right? So what the patient will experience with us, because we remove the need for amplification, right? All of a sudden, we can bring that medical value. So talk about a syndromic approach, right? Where 80+% of the time, right, you will get a result because we cover a lot of different pathogens. Turnaround time is another thing you can't compromise. Turnaround time needs to be in the 10 to 15 minutes, but most towards the 10 minutes. Because why? Because it allows the practitioner to have an active conversation with our patients. The other thing is the cost of the test, right? We have to make sure that the test is to the practitioner, fits within their economic. So there has to be a reimbursement and cost structure that makes sense. And then last but not least is the test has to be easy to run, right? So the way we build a test is, if you're familiar with any kind of lateral flow workflow, so because we remove the need for targeted amplification in our platform, the patient will experience a result after waiting hopefully much less time because the turnaround time is shorter, not being out of pocket, and then everybody wins.